I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and today I'm joined by Dr. Holly Peterson. Tell us who you are.
Well, thank you so much for having me. I'm the Director of Medical Breast Services at Cleveland Clinic, and I run the High Risk Breast Center.
So, we know that despite the fact that heart is the leading cause of death for women, all women universally are so anxious about their breasts and the risk for breast cancer. So one of the things I want to focus about from the consumer's point of view, from a woman's point of view, is what should she know when deciding when she should be screened and how she should be screened. So let's first talk about the when. What age?
Women should consider a baseline mammogram at the age of 35, and that's not a guideline-driven recommendation, but African American women do have earlier onset breast cancer, and Ashkenazi women are more likely to carry BRCA mutations. So particularly in those two groups, I think an early baseline is a good idea. And we still abide by starting at 40 and doing your mammogram yearly thereafter.
And which is confusing because there's so many other societies, including Canadian societies, that say 40 to 50 is a case-by-case decision and it's sort of off the table. 50 to 74 every 2 years, and it seems that everybody is grouped in one big basket.
And that's the problem, is that we can't identify low-risk women at the current time. And 75% of women who develop breast cancer don't have identifiable risk factors. So you can't assume that you're at low risk and start at 50. It's a shared decision-making discussion that you have to have with your healthcare provider, but you have to be aware that mammograms do save lives in your 40s the same as they do in your 50s, and at the present time we can't tell who's low risk.
So for many women who start at 35 or 40, one of the concerns is that breast density is very common. Breast density makes it hard to read a mammogram, but breast density is an independent risk factor for breast cancer. So what should these women be doing?
So about 70% of women in their 30s have dense breasts. That's nothing to worry about. And about 45 to 50% of women in their 40s and onward have dense breasts. But women should know their breast density and know that they have options for supplemental screening. The three-dimensional mammogram, or tomosynthesis as it's known, is more sensitive at detecting breast cancers through that tissue, and you have fewer callbacks for those false positives. Whole breast ultrasound is an option, but there are a lot of false positives. And MRI is typically reserved for the highest risk women, but there are some centers now that are offering an abbreviated MRI for a lower cost out of pocket, and that's certainly an option for women with dense breasts.
So what women should consider, and Dale will bring it up because they have a concern about this, genetic screening. Who should actually go forward and have either the founder panel or a more extensive panel of the genes that are known to influence breast cancer?
Well, and it's interesting that you say that they'll bring it up. They often won't bring it up. The women who are at the highest risk may be the least likely to bring it up. Mm-hmm. And it's hard. Just like going for that mammogram is hard, it's hard to bring up the conversation about genetic screening or genetic testing. If in your family you lost someone at an early age, it's hard to go back to that. And if they had breast cancer at an early age and did well, it's also hard to go back to that. But if you have a family member or yourself that had early onset breast cancer, ovarian cancer at any age, bilateral breast cancer, males with breast cancer, that's a big red flag, and now pancreatic cancer and metastatic or prostate cancer that's spread throughout the body. Those are sort of the red flags where you should really call that to the attention of your healthcare provider and ask them, about genetic evaluation for your family.
So I think the message that I'm getting from you is that it's very important for women to be empowered firstly, to know their family history. That seems one of the most critical pieces of information that you can know. If you have the ability to know your breast density, that too is important. And then not to be afraid to bring up this conversation to your healthcare provider about how should I be screened, when should I be screened, and how frequently should I be screened.
Oh, absolutely. Women need to be their own advocates, and more knowledge is more power. It's really up to us to look out for ourselves and our daughters and our sisters and our friends.
Thank you so much.
Oh, you're welcome. Thank you for having me.